Often when we think about eating disorders, we just think about the behavior of eating. But in fact, anorexia nervosa affects every single process in the body. It affects the way your child is thinking, it affects the way they are behaving, and it even affects their emotions. There are many things that you can't look at your child and tell are actually happening. And so it's really important that we go over what are the risks of anorexia nervosa. The most important are to their biological system. We know that inadequate nourishment, and let's be clear, for adolescents who have very different biological needs from adults, eating 1,600 calories a day is necessary just to keep your adolescent from going into organ failure, not including the excess activities that they do, such as going to school, playing with friends, engaging in sports, or learning. Your brain actually uses about a third of the body's glucose, and so we see cognitive changes as well. It's really important to understand that the effects on the body are total. Not eating actually leads to increased restrictive behaviors. In other words, not eating tends to lead to increased starvation. What effect does this have? Well, the first and most important is that when your body's not getting enough nourishment, it goes into a hibernation state. Rather like a bear, only your child probably isn't sleeping well, and they're almost certainly not gorging on salmon and burberries before hiding away for the winter's night. Instead, what happens is the blood starts to move toward the center core of the body. You may notice your child has very cold hands or very cold feet. They may report being colder than everyone else in the household, even when it's fairly warm out. Sometimes, with anorexia, kids will deliberately make themselves more cold because they've learned that shivering actually burns more calories. Now, when we're not eating sufficiently, not only do our hands and feet get cold, but the body takes other steps to stop engaging in what it considers wasteful behavior for health. In females, that's most typically obvious by loss of menstruation. If your child hasn't started menses, you may actually see that they stop developing breast tissue or stop appearing to progress toward menstruation or pubertal development. So they just look younger. In kids who've started their period, the absence of a period, which may start off as thinning or shorter periods or greater time between periods, and ultimately leading to cessation of menstruation altogether, are huge signs that the body's actually changed its hormone levels in order to shut off this vital function, because your child's not producing enough energy to be capable of withstanding normal everyday variations in hormones and development. Although some people think that adding birth control can help with this, it actually doesn't. And lack of menstruation is critically important for females in particular because hormone development actually influences brain development. Your child's brain is developing more between the ages of 12 and 24 than almost any other period of time in life. They're learning how to practice having an adult brain. They're actually developing the entire frontal lobe of their brain, and their body is actually beginning to bring online different neurochemical systems in order to help them learn new behaviors, rewards, and punishments. So it's critically important to recognize that such symptoms as loss of menstruation may not even occur to you as a major symptom, but in fact signal a catastrophic change in your child's metabolism. For boys, the symptoms are often a little less obvious and obviously a little bit more painful to ask about. The things that we see in boys are lack of nocturnal emission, or what we might call wet dreams, or a lack of early morning erections. Both of these signal a drop in the testosterone levels that are necessary for development. For both boys and girls, these endocrine changes are catastrophic to the body and development. In addition, for girls, having your period actually helps you place calcium in your bones for good bone health and development. This is one of the reasons why our female patients are at increased risk for osteoporosis even early on in the disorder. Don't let that escape you for males. If your child is a boy, they're also at risk for osteoporosis. It takes a bit longer. But when we see males with anorexia nervosa, they often have much more severe and long-lasting osteoporosis. So whether your child is male or female, you should be worried about their bone health.